Thank you, Lebo. This panel was supposed to have been moderated by Paul, but unfortunately he had to leave, so I'm going to moderate the panel for Transparency International. Well, thank you. The third panelist, is he coming? Ernest, are you on your way? Okay, so as Lebo has said, the panel is on inclusive service delivery in Southern Africa, overcoming corruption and discrimination in education and health. So access to essential services such as education, healthcare, and land remains persistent challenges across the Southern Africa development community. While countries have made significant strides in expanding service coverage and promoting social inclusion, deep-rooted corruption and discrimination continue to create unequal barriers, especially for women, girls, persons with disabilities, ethnic minorities, and other marginalized populations. So Transparency International, through its Inclusive Service Delivery in Africa project, has undertaken research in 4 countries, in Zimbabwe, Madagascar, Rwanda, Ghana, and the Democratic Republic of Congo, to explore how corruption and discrimination intersect to undermine access to these basic services. Paul talked briefly about this report and the research they did the day he sat with the panel that was talking about education financing yesterday. So the findings published in the report, Barriers to Basics, Corruption and Discrimination in Education and Health Services, reveal how systemic bribery, sexual extortion, favoritism, and abuse of power create barriers to dignity, equity, and opportunity. So these concerns are not just national, they are regional. SADC member states, through instruments such as the SADC Protocol Against Corruption, have committed to take collective action in combating corruption through legislative, institutional, and cooperative frameworks. So the protocol obligates states to promote transparency and accountability in the public service, criminalize various forms of corruption, protect whistleblowers and witnesses, strengthen the capacity of oversight institutions, and foster regional collaboration in investigations and prosecutions. However, despite the progressive language that is found in this protocol, many countries in the region have struggled to fully domesticate and implement its provisions, which happens with other protocols as well. Challenges include limited enforcement, weak political will, inadequate protection for anti-corruption actors, and a lack of civil society inclusion in oversight processes. So I'm happy to introduce the panelists who are sitting here. Tafadzwa Chikumbu from the Executive Director of TI Zimbabwe. Can we give him a round of applause? We have Liantsoa. I will not attempt to do the surname. She will say it herself. From TI Madagascar. A round of applause. We have Ernest Mpararo, the Executive Director for LICOCO DRC. Okay, so to begin our discussion, I will first of all ask the panelists just to introduce themselves properly on what they do in their respective roles in their respective countries. Over to you, Tafadzwa.
Good morning, everyone. Good morning. Good, thank you. We should have energy. It's still morning. Tafadzwa Chikumbu is my name. I'm the Executive Director for Transparency International Zimbabwe. I oversee programming and administration of Transparency International in Zimbabwe. Thank you.
Hi everyone, welcome in Madagascar. So my name is Liantsoa. I'm working in the education sector in Transparency International Madagascar, and I'm also involved in the research of the corruption risk assessment that I will present to you after, and also working deeply against corruption, especially sexual corruption. Thank you.
Oui, bonjour à tous. Moi, c'est M. Ernest Mpararo. Je suis le secrétaire exécutif de la Ligue congolaise de lutte contre la corruption, la LICOCO, basée à Kinshasa, en République démocratique du Congo. Nous sommes membres de Transparency International et nous travaillons dans plusieurs secteurs, à l'éducation, santé, dans les mines, au niveau de la justice. Nous participons avec le gouvernement dans plusieurs réformes, les réformes financières, les réformes de la justice, les réformes foncières, les réformes climatiques, toutes les réformes, nous sommes associés. Il y a des collègues avec qui nous travaillons qui sont ici, qui sont dans le secteur de l'éducation, qui sont là. Et je pense qu'à travers ces rapports que nous allons discuter ensemble, nous allons tous partager les expériences, étant donné que la corruption impacte tous les secteurs que nous avions parlé depuis lundi jusqu'à aujourd'hui. Les inégalités, la corruption sexuelle dans plusieurs institutions, dans les universités, ça impacte effectivement la promotion du genre dans tous les domaines. Donc, merci beaucoup.
Okay, thank you very much for those introductions. Now, I'll ask each one of you to respond to this question based on the study that was conducted in your respective countries. So may you share your country experiences on corruption, discrimination and marginalization in the delivery of public health and education. So I'll start with you, Tafadzwa.
Thank you very much, Julie, for that important question. This is a research that we conducted in Zimbabwe, but we also had a similar research carried out in Madagascar, DRC, Rwanda, and Ghana. So if you check this research online, it's called Barriers to Basics. Barriers to Basics. You actually find this study, and you can see the various and different experiences, though related from our various countries. So from this study, we established that corruption and discrimination affects access to basic services. It also affects availability of public services to our people, and it also impacts on the quality of services. I think looking broadly from the broader definition of corruption, which is abuse of entrusted power for private gain, both at high-level corruption and also petty corruption, you would agree with me that we do not enjoy the services that we are supposed to enjoy because the resources are diverted from the public service itself. I'm happy to also reflect and say that the UN recently came up with a resolution to consider corruption a human rights under their resolution AHRC 59/L6 in June 2025. This is something that we have been grappling with for a very long time, because if services are taken away from the people, ultimately it impacts on the human rights of individuals, especially the right to health and education. So before I share the specific findings from the Zimbabwean study, I want to speak about a common thread across the 5 different countries. So from the researches that we carried out, the first thread suggests that discrimination can result in greater exposure. So where there is discrimination, there is greater exposure to corruption. And this, specific to Zimbabwe, we looked at people who are discriminated on the basis of, especially for people with disabilities and people living with HIV and AIDS. And those specific individuals, because of the specific need that they do have, they interact more with the public officials in terms of delivering of public services. And as a result, they are more exposed to different forms of corruption, not limited to just bribes, but sometimes even sextortion, where sex is used as a currency to pay for bribe. The second thread is that certain acts of corruption are directly discriminatory. There are certain acts of corruption which are discriminatory, and in our studies we established that corruption, especially around nepotism and favoritism, is actually discriminatory in nature. And this is something that you find from across the researches. Then we also established that impacts of corruption are felt disproportionately by groups at risk of discrimination, especially women, people with disabilities, and other groups that you may think of are disproportionately impacted by corruption. Then the fourth thread is that both corruption and discrimination can result in denial of justice. So where corruption thrives and where discrimination is possibly exacerbated by corruption, we deny, or we are denied of the justice that is due to us. And I always say that there is a thin line between justice and human rights. And I think you can agree with me. And the last thread is that corruption impedes the effectiveness of measures designed to advance inequality. So I will start my sharing, especially of the Zimbabwean experience, on the basis of this specific finding, that where corruption happens, even if there are noble policy reforms that are implemented, corruption comes in and distorts and exacerbates inequality in our society. So I'm going to share findings of a study which we called Failed Promises, Impacts of Corruption in Education Access Scheme in People with Disabilities in Zimbabwe. So in 2001, the government of Zimbabwe introduced what they call Basic Education Assistance Module, commonly known as BEAM in Zimbabwe. Those from Zimbabwe, I think they can relate to the BEAM scheme that is implemented. So that particular scheme was designed to assist people who are disadvantaged either socially or economically, so that they can have access to education by way of paying for school fees and other levies in schools, including even exam fees between primary and secondary students. And this particular program is a very good program, which is aimed at ensuring that those that are disadvantaged can actually benefit from this scheme. But however, over the years, especially when the country was going through macroeconomic challenges as a country, disbursements to various schools were late, and they are also still late. And as a result, parents who are actually supposed to benefit from this particular scheme are then asked to advance in terms of payment of school fees, and the assumption is that when disbursements are made, they are paid back in terms of their money. And this particular scheme is now marred with a lot of challenges, especially around corruption. So the first thing that we established from the people that we spoke to said that even after advancing and when the money is disbursed, they are not given back their money, and this money is actually shared amongst the school authorities. So it's one risk that we identified. And we also learned that the people or deserving individuals, especially those people with disabilities or children with disabilities who need to be assisted, who need assistive devices, and other special needs, they actually do not benefit, but they benefit individuals on the basis of whom they know. So there's a lot of nepotism around who benefits from this particular scheme, and ineligible children end up benefiting at the expense of those that are in need. Then the other issue is around bribery. So people can actually pay to the authorities to allow them to be considered at the expense of those that are actually supposed to benefit from the scheme. So those are some of the corruption related issues that we find out. And with this happening, we also established that the framework for the BIM scheme is very clear in terms of the complaints handling mechanism. It's quite clear. But unfortunately, because of the corruption and the trail of people who benefit from the scheme, there is no recourse, especially around the people that are affected by the corruption that happens in this particular scheme. And in most cases, when they raise their complaints with the Ministry of Public Service Level and Social Welfare or Ministry of Education, some of their queries are taken by interns. They do not get the attention that it deserves. And as a result, we continue to have these cases. And we also noted that issues of stigma and discrimination particularly impacts on the people, especially parents of children with disabilities. One of the respondents we spoke to said that when she goes to school, the teachers would actually say, the way you are dressed and the way you look, I don't think you should deserve this particular scheme. But then the person who is supposed to benefit is the children or their child. And so we saw that sometimes either the parents, they are stigmatized, or even the children themselves. The moment parents with children with disabilities goes into school, they say that because of late disbursements, I think we should not take children with disabilities because they will not receive the disbursements and the kids should not learn for free. So these are some of the concerns that they were raising. And as Transparency International, we feel that there is that nexus between discrimination and corruption. It is not only one directional, it is actually a causal relationship. Where there's discrimination, corruption thrives, and sometimes corruption does exacerbate the discrimination amongst various groups. And the last part of our research was focusing on access to antiretroviral drugs, especially by patients that are living with HIV/AIDS. And we noted that in 2010, a research that we did as Transparency International, we established that 73% of people with authorities reported that they have been asked for bribes for them to access antiretroviral drugs. That was in 2010. And then in 2010, during the COVID-19 pandemic, we also did another research, and we also established that people were also asked for bribes to access antiretroviral drugs, and the people that sit on the other side of the table that have a responsibility to supply the antiretroviral drugs, they took advantage of the situation, especially when people with the underlying conditions were actually being affected the worst. And because of that, they were requesting for bribes for these people to have access to these services. And we also noted that the UNAIDS carried out a study globally and established that there are 5 key groups that are impacted the most by HIV and AIDS. And this includes sex workers, gay men and other men who have sex with men, transgender people, people who inject drugs, and people in prisons and closed settings. So these people, they are impacted the most, especially in societies like Zimbabwe, where they are stigmatized and where their rights are actually criminalized. So as a result, access to antiretroviral drugs, especially to them, comes at a cost. So for them to access these services, either they now have to pay certain individuals to give them the antiretroviral drugs, or sometimes they go against their own privacy to ask other people to go and access the services that they desperately need. And we established that in Zimbabwe, for people to access these drugs, they are illegal and illegitimate costs that are introduced. In Zimbabwe, they call it a knock-knock fee or a go-go-go fee in Shona, where you have to pay an amount to get a card, but yet these services are supposed to be for free. And failure to do so, you don't have access to the service, so they actually have to pay that amount for them to get the service. We also established that health care officials, they actually have parallel service channels where they say the drugs are not available, but if you want them, you can actually get them from certain individuals at a fee. So they divert resources to their own private shops so that they can sell them. And sometimes they even divert them to private pharmacies, yet these are supposed to be for free. And I just want to conclude by saying that corruption does not only happen where the payment of a bribe is in cash, sometimes it is in kind, and in most cases where payment is made in kind or through sex or sexual advances, the problem is that the victims rarely speak out against that because of the societal values that we have, especially in our continent. So we do have people who suffer in silence and they continue to be victimized, especially around access to public services. I thank you.
Thank you very much for sharing those insightful examples. I'm sure it rings a bell with, it resonates with what happens in all our respective countries. There's quite a lot of corruption and discrimination that is happening. But if this is not, if it goes unchecked, it will continue. So thank you very much for raising those issues, and we'll be interested to hear later on what impact these findings have had and how you have utilized this report. Thank you. We'll move on to Madagascar. So the same question, can you share your country's experience on corruption, discrimination, marginalization in the delivery of public health and education? Over to you, Liantsoa.
Thank you, Julie. So, as Tafadzwa said, we also conducted our study in Madagascar since 20 and 23. And we made a special study about the link of discrimination and corruption regarding the basic services in education and health sectors. So we made this research in 7 regions in Madagascar, included the capital. And we found that corruption existed in every level. So, because it's in every level, we decided to focus our study regarding the education sector, for example, in the file registration, and the same to the health sector when the patient go to the health center and want to get more care for their children and for pregnant women. So let's start with the education sector. We approach around 400 people in these 7 regions, and we also especially searching for vulnerable people, especially pregnant women, people who have disease, people who have vulnerable motor skills, and then we ask them some questions that we prepared before. So most of these persons say that the vulnerability increased the corruption when they want to access for education. So the conclusion is their vulnerability increased the lack of access of education, and in Madagascar, as said by the report, there is no inclusivity. Yes, we can find some schools that apply the inclusive rules in their schools establishment, but in general there is no inclusivity for the access of education, especially in the rural areas. So some people say that, for example, in the rural area they must pay more expensive money to get some class, and sometimes some rich people have an access to some activities that the vulnerable people can't access if they don't pay more. So this is a kind of discrimination that we found it in the study. And another example is the practice of sexual corruption in the rural areas again, that if some students, some children want to have their certificate, for example, they must have sexual relation to the professor, or sometimes if they want to have good grades, it's the same process. They must have the relation, sexual relation with their professor. So the impact of that is the abandon of the school dropout, sometimes the lack of motivation, but also the parents decided to drop out in general their schools to help them in the field, and sometimes also to let them read without their consent. So this is the kind of highlights that we found regarding the education sector, but it's not very far from that regarding the health sector, because, for example, if the woman gave birth of a boy, the parents must pay more expensive than the girl, even though the price of giving birth is everywhere, that people know everywhere in the primary health care, for example. And sometimes also, because of that, some women decided to give birth at school, not at school, excuse me, at home, than at the hospital center, because they don't want to pay more. Sometimes the treatment of the vulnerable people is not the same of the people who can give more money, and sometimes also some women are discriminated by their age or their ethnicity. So in general, we can found that corruption is everywhere, and the vulnerability of people is one of the limits of access to healthcare services and education services. And we can also found that the link of corruption and discrimination increased the vulnerability of the existence group, and sometimes it also reinforces the corruption regarding these groups, because they are considering of stranger in the community. They are considered like a person who are not accepted to the community, so it increased the discrimination. So we can also find in the education sector regarding the recruitment process that some teachers are victims of discrimination because of their always physical appearance, sometimes also because of they don't have money to give to the administration. So we found that recruitment also is impacted by corruption regarding the treatment of the curriculum vitae of the teachers, for example, or the call for recruitment to the teachers. We found that sometimes, even though we recruit the teachers here in front of the public, behind there is a list of teachers who are already ready to be shared to the establishment for the teachers who can access to the some establishment. So it's also the impact of the corruption regarding the education sector. So maybe I will finish my intervention now, because I lose my time. We can continue after. Thank you.
Thank you, Liantsoa. Okay, interesting findings that are coming out from that study. Paying more when you give birth to a boy child than when you give birth to a girl. Very strange things happening. If left unchecked, these things will continue. Okay, thank you very much for that. I hand over to Ernest now to hear the findings from DRC.
Oui, merci beaucoup. Et comme vous le savez, l'évaluation vraiment été un exercice pertinent. C'est quelque chose de pratique. Ce n'est pas des choses que nous inventons, qui viennent de nos têtes, non. C'est quelque chose de pratique. Dans le secteur de l'éducation, nous avions évalué 4 axes prioritaires. Comment on accède à l'enseignement, l'inscription des élèves. Ça se passe comment? En RDC, il y a des écoles qui, alors que la loi stipule que l'inscription doit être gratuite. Mais tu sais qu'est-ce qu'ils font? Ils font des tests d'admission pour effectivement avoir de l'argent. Ces tests d'admission n'est pas gratuit. Ce sont des tests qui sont payants. Et les familles qui n'ont pas d'argent ne peuvent pas payer ces tests d'admission. Ils sont déjà discriminés. Et lorsqu'il y a une limite, ils savent que nous allons prendre par exemple 100 personnes. Ils inscrivent 1000. Donc, ils prennent à peu près l'argent pour 900 élèves ou 900 familles. C'est déjà un risque ou une faiblesse dans le système d'inscription, dans le système éducatif. Le deuxième la deuxième évaluation que nous avions faite, c'est comment on recrute. Comment on recrute les enseignants. Le premier jour ici, on avait dit la qualité de l'enseignement. On avait parlé sur la qualité ici, le lundi. Alors, comment est-ce qu'on les recrute pour améliorer cette qualité-là? Comme notre collègue de Zimbabwe a dit, en RDC, depuis toutes ces années, on recrute par favoritisme. Je me connais avec les ministres, je me connais avec le secrétaire général, je me connais avec l'inspecteur. Allez, je suis enseignant, point barre. Il n'y a pas de concours, il n'y a rien. Ce qui fait quoi? Ce qui a comme conséquence, nous avons des enseignants qui n'ont pas la qualité et qui n'ont pas d'expérience et dont l'intégrité est doutée. Parce qu'il n'y a aucune évaluation sur l'éthique et l'intégrité. Et l'autre aspect que nous avions, comment on organise les tests d'admission ainsi que dans les écoles. Dans plusieurs écoles de Kinshasa et de la RDC, lorsqu'on organise des tests, tu sais ce qu'on dit? On vous dit, bon, il faut amener des papiers, il faut amener des savons, il faut amener... Donc, on vous demande des matériels. Ce sont toutes ces pratiques qui concourent effectivement aux discriminations parce qu'il y a certaines familles les plus pauvres, les plus vulnérables, ces familles-là ne peuvent pas avoir tout ce qu'on leur demande. Et, conséquence, toutes ces familles ne pourront pas amener leurs enfants à l'école. Quatrième aspect que nous avions évalué, c'est comment on fait les contrôles, comment on contrôle le secteur éducatif. Au niveau du gouvernement, il y a ce qu'on appelle une direction de l'inspection. L'inspection de l'enseignement primaire et secondaire. Mais est-ce que cette inspection est-ce que cette inspection travaille bien? C'est tout un problème parce qu'ils sont en train d'inspecter des aspects sur la qualité de l'enseignement et sur le respect du calendrier scolaire. Et dans plusieurs écoles, comme ces inspecteurs ne sont pas bien payés, ils n'ont même pas, ils travaillent dans des conditions difficiles, ils se font corrompre par les écoles. Ils sont obligés, ils ont la mission de regarder même les bulletins si l'élève si les critères d'inscription ont été bien respectés, mais ces inspecteurs-là, comme ils sont corrompus par les responsables des écoles, ils ferment les yeux. Conséquence, nous avons un système éducatif qui est hyper corrompu. Alors, pour résoudre cela, depuis l'arrivée de l'actuel président au pouvoir, il a fait la gratuité de l'enseignement primaire. C'est la gratuité seulement de l'enseignement primaire. Mais au niveau secondaire, les parents continuent à payer. Et c'est au niveau secondaire où il y a tout un grand problème parce que même au niveau primaire, là où il y a la gratuité, il y a toute une gamme de familles qui ne peuvent pas amener leurs enfants à l'école. Ce qui fait qu'aujourd'hui, il y a plusieurs millions d'enfants qui n'étudient pas, qui sont en âge de 5 à 12 ans, qui sont en dehors du système éducatif. Au niveau secondaire, aussi comme ce sont les parents qui soutiennent, ce sont les parents qui payent, les parents qui sont les plus démunis, les parents les plus pauvres ne peuvent pas amener leurs enfants à l'école. Et ça se passe dans nos provinces, ainsi de suite. Il y a aujourd'hui à peu près 39% de filles qui n'accèdent pas au système, qui ne parviennent pas à terminer l'école secondaire. Pourquoi? Parce qu'ils n'ont pas d'argent pour payer les enseignants, ainsi de suite. En ce qui concerne le secteur sanitaire, c'est presque la même chose. Pour accéder aux soins de santé, on vous demande d'abord la fiche. Et la fiche est payante. Donc, on doit vous enregistrer pour enregistrer les malades et vous devez payer. Déjà, ça discrimine déjà les personnes qui n'ont même pas de moyens. Et c'est ce qui amène à ce que la plupart de nos citoyens, de nos concitoyens, à recourir à la médecine traditionnelle. Pourquoi? Parce que déjà, lorsque vous approchez à un centre de santé, on vous demande la fiche. Et la fiche est payante. Lorsque vous quittez la fiche, vous allez voir les médecins. Chaque médecin a son prix. Si vous partez dans un hôpital en ville, il y a un prix. Un hôpital qui est tout près, dans les périphéries, il y a un prix. Donc, il y a pas, et ce sont des hôpitaux publics de l'État. Ce ne sont pas des hôpitaux privés. Ce sont des hôpitaux publics. Et la même chose, comment est-ce qu'on recrute les personnels médicaux? C'est par favoritisme. Nous avions posé la question au secrétaire général du ministère de la Santé, qui nous montre une liste où ils ont recruté par concours. Il n'y en a pas. Il n'y a pas de recrutement des enseignants, des infirmiers ou des médecins par concours, il n'y en a pas. On les recrute par favoritisme, par tribalisme, par patronage, et ainsi de suite. Conséquence, nous avons des infirmiers et des médecins dont le cursus est tellement, dont le cursus pose problème. Donc c'est tout un danger. Et vous voyez comment est-ce que la corruption est en train de nous miner. Vous risquez d'avoir un infirmier qui va te piquer, qui va te soigner. Il te soigne la maladie, la malaria, mais il te donne un autre médicament. Parce qu'ils ne sont pas qualifiés. À cause de quoi? À cause des actes de corruption. Et toujours dans le même, nous avions pris la même méthodologie pour voir est-ce que le mécanisme de contrôle est efficace au niveau du secteur de la santé. Toujours la même chose. Nous avons ce qu'on appelle en RDC l'inspection générale de la santé. C'est un service qui vient contrôler tous les aspects sanitaires. Est-ce que si vous respectez la déontologie, vous respectez les lois, les règles, tout ça ce qui a été dicté en matière sanitaire. Et aussi, ce sont des vieux papas qui ont l'âge même d'aller en retraite, mais on les utilise parce qu'ils ne peuvent pas aller en retraite, étant donné que le gouvernement n'a pas de moyens pour payer les retraites. Donc, conséquence, ils passent en train de recueillir de l'argent par-ci, par-là, et tout en violant, tout en mettant la vie des citoyens en danger. Nous avions même étudié comment est-ce qu'on s'approvisionne de médicaments. On constate effectivement qu'il y a beaucoup de dons qui arrivent. Il y a beaucoup de dons qui sont donnés par des organismes internationaux au gouvernement. Et vous savez quoi? Tous ces médicaments se retrouvent dans les dispensaires et pharmacies privées. Or, la loi dit, par exemple, les médecins ne peuvent pas, lorsque tu es médecin au niveau du public, au niveau de l'administration publique, tu ne peux pas prester dans le privé. Mais qu'est-ce qu'on constate? On constate que les médecins font le cumul. Le matin, il est à l'hôpital public et le soir, il te consulte. Et dans plusieurs institutions médicales, on a constaté effectivement qu'il y a détournement des malades. Lorsque vous vous approchez à un hôpital et le médecin pense que tu peux avoir beaucoup d'argent, il te dit non mon cher, est-ce que tu peux me rencontrer à 16h? Il te donne une adresse. Là, je peux bien te soigner. Tu sais, ici, nous sommes en train de... Donc, il te donne un motif là pour qu'il puisse aller te soigner en privé pour que tu le payes. Et tout cela fait que les familles les plus vulnérables ne peuvent pas accéder aux soins de santé à cause de ces mauvaises pratiques de corruption. À ce qui concerne les groupes les plus... Je termine. À ce qui concerne les groupes les plus vulnérables, les handicapés, les albinos, les vieillards, ils n'ont même pas de soutien. Il n'y a pas d'assurance en RDC. Il n'y a pas de sécurité sociale en RDC. Et ce sont des laissés pour compte de la société. Ce sont des gens qui se débrouillent. Vous les voyez dans le rue en train de mendier parce qu'ils n'ont même pas la protection sociale. Conséquence, c'est ce qui fait qu'aujourd'hui, il y a au moins la pauvreté est en train de grandir, d'accroître au lieu de décroître. Pourquoi? Parce que la corruption est l'une des causes de tous ces méfaits d'exclusion sociale ou des inégalités que nous avions suivis. Merci beaucoup.
Thank you very much for sharing the experience from DRC. We have seen from all the three countries what is coming out from the study. And you will find that it's the most marginalized people that are at risk here. They are the most marginalized people that are affected in all these cases. So I'll quickly open it up to the floor. If you have any quick comment or question, please, no presentations, just a minute each, because we don't have much time left.
Before an announcement?
Okay, sure.
Yeah. Thanks. An announcement. It appears that tea breaks here are not very favorable for most of us. We have sessions that are ongoing here. People are outside grabbing tea, and those that are inside the room, when they get out, there's no tea. So, Julie, I was thinking, like, how about, for purposes of time, one table goes and grab their tea and they come back, and the other one like that, so that I manage the people from outside, because I see infiltration of people coming from outside, taking tea and going when we are seated in here. So I would want maybe from the start there to do that when I manage outside, so that we do not lose time. Thank you.
Okay, over to you.
Is it on? Okay. Thank you very much for your presentation. My question goes to Tafadzwa from Zimbabwe. I got so worried about the beam that you were talking about, the money that is disbursed in different communities, in schools. So I just wonder, from your research that you did, are there any, what mechanisms are there that are on the ground to make sure that we ensure the proper utilization of these disbursed funds? And at the same time, did you manage also to see whether there are any monitoring systems and also any oversight structures that are there to make sure that we track the existing funds that are given in schools? And my second question is, how can CSOs, us, can best collaborate with the communities is in terms of documentation or in providing this oversight, and also in terms of advocacy against this corruption that you have mentioned? Thank you.
Thank you. Any other hands? Yes, over there.
Thank you very much for giving me the opportunity to tell about our solutions. I'm from the region of Rakotoarivelo in Madagascar, and what I am to say, I'll be brief, very brief. Everything that has been said about corruption and violence is real, but I must say that the very problem, what is to be said is the solution. What to do to eradicate these violences, these acts of corruptions. And what we do in Rakotoarivelo is plain, corruption and violence, everything, that's all violences. So you must react violently against this. Perhaps you'll find that I am somewhat violent, but there is no solution. So if someone, if you find that someone is committing violence in hospital, for example, or in the level of administration, we go straight to this woman or to this man, and we tell him bluntly before him, face to face, eyes to eyes, that what he's doing is not good. And we tell him to stop, to arrest. And we even go to his house, to your house, to tell him, to tell her to stop doing this. And they stop committing violence.
Thank you very much for
much
sharing that experience. Do we have any other hand? Okay, so this will be the last hand.
Thank you. I think it's clear from the countries that are represented in the presentations that there are systemic underlying conditions that exacerbate. Sorry, I'm from Zimbabwe. There are systemic underlying conditions that exacerbate corruption and affect service delivery, economic growth, and other factors. My question is, what accountability mechanisms have proven the most effective in reducing corruption and its associated risks? And what can we do as a continental bloc to reduce corruption risks in the education and health sectors? Thank you.
Thank you very much for that question. All right, so Tafadzwa, you have 2 questions. I think the other one from Madagascar was a comment on how they address issues of corruption, which thank you for that suggestion. And then on the accountability measures, I think any of the panelists can take that one. So we'll start with Tafadzwa. As you are, after responding to the question, I'll ask you also to talk about the recommendations. At least give us 2 recommendations. So we'll do the same so that we keep time. Thank you.
Thank you, colleagues, for your questions. So, as I've indicated earlier on, the BIM scheme itself is a very noble idea. And it has a specific framework which is followed to ensure that there is transparent selection of people and that there is a clear reporting mechanism for any abuse of the scheme. So the selection of the candidates for BIM, according to the module that was developed, actually involves people from the communities themselves. So it's a committee that involves people with disabilities, people living with HIV and AIDS, women, and it actually specifies that 50% of the committee members should actually be women. So on paper, the mechanism is in place, but unfortunately, it's not being adhered to. And this is the challenge, not just with the BIM scheme, but with most government programs, where black and white prescriptions are quite clear, but for some reason or the other, especially when the people involved benefit from the lack of enforcement, it so happens that the structures are not respected. And the Ministry of Public Service, Labour and Social Welfare is the same ministry which governs the operations of charitable organizations in Zim. And they do encourage working relationship between themselves and civil society. And I do believe that we should utilize that space to ensure that civil society is also involved either in the selection process, monitoring, and evaluation of the BIM scheme. And I'm happy that we do have the Education Coalition with us, and we do hope that we can actually create synergies from their specific sector to ensure that the monitoring happens. But as Transparency International Zimbabwe, we also have local structures that we work with to ensure that we monitor what happens within their specific communities. Julie, can you allow me to speak around the SADC? Yeah, because within the SADC region, we do have a whole protocol against corruption, which specifies what needs to be done in terms of combating corruption in our countries. But for a long time, the protocol has not been fully implemented. But recently we observed that they now developed a monitoring mechanism which requires member states to record progress that they have made in terms of implementation of the protocol on an annual basis. But as Transparency International, our concern has been on the indicators, because it talks about either the number of prosecutions that they have made, the number of anti-corruption institutions